Hello, welcome to this video on the REZUM procedure. My name is Dr. Sivarajan, and if you are watching this video, I would assume that either you or someone you know is considering the REZUM procedure for BPH. BPH, or benign prostatic hypertrophy, is the medical term for prostate enlargement. This issue of prostate enlargement affects men as we age, as the prostate grows into the urinary channel and causes obstruction. This obstruction is responsible for many of the difficult urinary symptoms that men may deal with as they age, including a weak stream, a stuttering urine flow, and incomplete emptying, as well as daytime and nighttime frequency of urination. In severe cases, untreated BPH can lead to urinary incontinence, complete urinary retention requiring a catheter, and severe issues such as infections, sepsis, and kidney failure. The REZUM procedure is one minimally invasive surgical option to manage prostate enlargement. The procedure is optimized for patients whose prostates are between 30 and 80 cubic centimeters, and patients in whom their prostate anatomy is amenable to the procedure. It is very important that you have your prostate anatomy and size evaluated before selecting this procedure to make sure that you are a good candidate. If you are deemed to be a good candidate for the procedure and it is your desired choice, generally the procedure will be scheduled in the office without any anesthesia other than a local numbing agent. This is the preferred pathway for this procedure as it is a very short procedure, less than 3 minutes in total, and generally the risks of anesthesia are not worth the benefits. In general, you will arrive to the office at the time of your appointment. If you have requested a Valium or some form of an oral sedation agent, then you should be sure to have a driver who has brought you and who will take you home after the procedure. When you arrive at the office, you will be brought into the procedure room and asked to remove the clothes from the lower half of your body. You will have been taking antibiotics in the days leading up to the procedure as a precaution, and you will have cleaned out your rectum using an enema or some other form of oral agent so that there is no stool in your rectum at the time of the procedure. The first minute of the procedure will be simply anesthetizing your prostate and urethra. You will have jelly instilled into the urethra, which has lidocaine, a numbing agent, pre-mixed into it, and an ultrasound will be used to inject your actual prostate and the nerves surrounding it with numbing agent as well. This first minute should feel no different than the ultrasound that was performed at the time that your prostate was sized. Once this is complete, the second minute of the procedure will be essentially waiting for the numbing agent to take effect. The actual meat of the procedure will occur entirely in the third minute. Most patients will get between 2 and 6 injections of water vapor or steam. Each injection will be administered directly into the prostate and will last 9 seconds. At most, therefore, the procedure will be 54 to 60 seconds long. The uncomfortable portion of the procedure is generally restricted to the first 5 to 10 seconds. Much as in your preoperative cystoscopy, you will feel some discomfort as the urethra and prostate are first entered with the camera. Once this part is over, it should be smooth sailing. You will be able to watch the procedure on the monitor that is located next to your head if you would like. Generally, I will be speaking to you throughout the procedure in order to keep you abreast of how many injections you've received and how many more will be left. After the injections are complete, the camera will be removed and a catheter will be placed into your bladder. The catheter is a small tube that will traverse your urethra and automatically drain the urine from your bladder into a bag located on your leg. Generally, the catheter will stay for between 3 to 5 or 6 days, depending on the number of injections you received during your procedure. You should expect to have some blood in the urine on and off, as well as some blood and some urine leaking around the catheter through the tip of your penis. You should prepare in advance to have some form of pad or additional undergarment to catch some of this blood or urine that may leak out while the catheter is in place. You will be sent home with a couple of prescription pain medicines. Generally, a narcotic is not required, but something stronger than Tylenol or Motrin will be prescribed for you if you would like. Most people simply use either Tylenol or Motrin for any mild discomfort they may have, but it's better to have the medicine and not need it than to need it and not have it. Your follow-up appointment for catheter removal will be made for you before you are discharged from the office on the day of the procedure. You will also have a few antibiotic pills left for you to complete the evening of the procedure and for use the next day. You will be taught how to empty the bag of the catheter and how to keep it secure to your leg before you are discharged home after the procedure. This is very easy to manage and should not cause you any stress in advance of the procedure. The catheter removal is done in the office and takes less than 15 seconds. Again, it is just a mild nuisance and should not cause you any consternation or worry about the procedure. When the catheter comes out, you will generally begin urinating normally, albeit with some residual blood in the urine and some frequency of urination for the next week or two. The benefits of the REZUM procedure will start to become apparent about 2 to 3 weeks out after the procedure.